are very many causes. Usually they are categorized. The psychological factors, like you could have gone through severe childhood trauma or a stressful life event, like you lose a loved one, that might predispose you to a mental illness. There are also biological causes. Biological causes meaning you could have a brain tumor, you could have an infection, you could have an hormonal imbalance, or you could have something we call imbalance of neurotransmitters. Neurotransmitters are those chemicals that your brain produces to ensure that your brain is functioning normally. So if your brain is not able to produce these chemicals in an appropriate manner, you might end up with a mental illness. There could be also genetic predisposition. Some inherit those genes and end up getting mental illness. There are also social factors like drug abuse, alcohol abuse, your current living situation. Maybe you're in a job that is stressing you. That might predispose you to a mental illness.
Is it genetic? Can it be, I guess that would mean inherited? Can it be inherited?
That's what genetic really means, that it runs in the family line. And therefore, sometimes when we are looking at people, then those are the people we are looking at and saying, enda uchimbe kwenyu. But really iko kwa damu. Si walienda sijuu wakafanya kafara. It's actually in the blood, and there is some defect or in the genes. So yes, it does happen. But then also we do have other factors that we talk about, in as much as they are classified as psychosocial, we call them spiritual factors. Sin is a precursor. Some of us know what we should not do, then we do. Then guilt eats you. And it really eats you. Like some of the people I have met with coming from the church that are not willing to talk loudly about are people who are struggling with sexual addiction. Pornography is rife, especially in the advent of these things. And then atakuja hata hapa, atalead worship and stuff like that. So when you go back, you have so much guilt. And you develop something we call cognitive dissonance. You know what you should do, but you are not doing. You know the struggle of Paul. You are not doing it, and therefore inakukula. After that, you develop a disorder. It could be the sins of others. For example, and now not that generational. Think about a mother who is drinking kumi, pombe, whatever you are taking, or even mira, alcohol, whatever. But let's talk about alcohol. Then they get pregnant. There is a child who Perez and my fellow doctor here is going to deliver, and they will have something we call fetal alcohol syndrome. So the mother is okay, but the baby coming out is already doomed to develop a mental health disorder because of the development of the brain. Remember, as Joy? Dr. Joy is saying, neurotransmitters, they are there in the structure of the brain, then we have a problem. So sin, when you look at it now from a spiritual side, we'll call it sin, because those are things you ought not to be doing. And so it is important to also add the spiritual element. I know people will talk about demonic possession, and it is true to some and not to everybody. The trick and the challenge of mental health as a mental health worker is to identify the root cause of the condition. Because you must separate. You diagnose, but what is the root cause? Then we have an appropriate intervention.
Yeah, because the issue of knowing the root cause, I think, should be the key thing. Still with the matter stigma and stigmatization. I don't know how you are managing the society. I don't know who is going to answer that. that people should know that this is an illness like any other illness, and therefore we should not put buffer zones in life?
Okay, we talked about, or rather I mentioned that stigma comes from not knowing what mental health is and what it entails. So the bottom line is to teach the community. For example, like we have this, it is not even a mental awareness week, it's a whole month of sensitization, talking about mental health, talking about the signs and symptoms, talking about the stressors that lead us to get mental health. Dr. Mumbi said we are all prospective, patients. Sometimes we look at others and think inakuja kwa hao sio kwetu, and we bring in the issue of nikurogwa, it's evil, it's nini hii maneno yote. But mental health is a disease like any other. Just like we have patients who are diabetic, patients who are hypertensive, patients who have any other illness, mental health is a sickness like any other. And so we should not stigmatize our patients. We should not look at them differently. Sometimes we look at them and think, ni yao, wao ndio waliandikiwa, familia yao, they are prone to that, it's not us. And that brings stigma, because we do not look at the person, but we look at the disease, and we tunakaa hapo kwa ni ugonjwa. Like even when I'm actually, let's say for example, at hospital, I'm trying to talk about a patient who has depression. I'll talk about huyo mgonjwa yuko number 5 akona depression. That brings stigma. So we should not look at the disease, but the person. That is Farida Kagore, akona depression.
Let me add, because part of the stigma doesn't come just from the community. The community leaders themselves have the ability to stigmatize. And I talk from the church context, because I come from the church, I've grown up in the church, and our ministers, unlike Bishop Mohuko here, who is a caregiver, so I believe him, he's different. But most of them are the same ones who stigmatize mental health and mental health disorders. So I tell people, the reason I actually deviated, and now the Lord has called me into what we call integrated mental health promotion, which is what I did my doctorate on, is to be able to marry scripture and to marry the science. And so now what I have figured and what the Lord has impressed on me is that we are having ministers that really wound the church. So as of this year, one of the things that now has happened is that I am going out training pastors, ministers, to help them understand mental health, so that when you come in, he receives you in a manner that is worthy receiving a child of God. And so that I also leave with you as a prayer that itaendelea. The fire can spread.
Dr. Perez, neurotransmitters. And as you answer that, tell us about issues of drugs, and how is it related? And can prolonged use of drug probably lead to issues of mental illness? And really can probably the mental illness itself lead people to drugs? How is it interconnected? Yes, and try to give us some Swahili words.
Okay. A very easy way of explaining neurotransmitters is like chemicals inside the brain that just fire. Like the way you can have an electrical impulse where you...
Like fireworks.
Like fire.
Like fireworks.
So, there are those chemicals that are inside our body which help us to either to function even on a normal day to day. That is what will, for example, when you have panicked, you will find your heart will beat faster. And the reason it's beating faster is because part of those chemicals have been activated to enable you to run or to fight. So some of those they actually circulate in the body, but you'll find them firing a lot inside the brain. And those ones will help even with our mood. Yeah? That's why sometimes you'll find you're excited, maybe you're moody, you're down, all those sometimes are as a result of some of those chemicals. Yeah? So the second question was on drugs. If we take drugs, do these drugs affect us? Can they lead us to mental illness and vice versa? Yes. They can lead us to mental illnesses, and the mental illness itself or disorder itself, the way we are feeling, can also lead us to go into drugs. So if we start with the first one, let's say I'm taking alcohol or bangi or whatever. What do? They will act centrally. Oh, okay. Back up a bit. Our bodies have what you call the central nervous system and the peripheral nervous system. So we have certain drugs, even alcohol, whether it's bang or it's these hard substances like heroin and cocaine, even codeine, they tend to work centrally in our bodies. And when they do that, you've heard people saying that it gives them a high. So that is what the person is going for when they're taking that drug. And so many times you'll find that if I'm not on the drug, I want to have that high, then I will keep going back to the drug. And in my normal state, maybe I am having some mental disorder, but then I am having escapism by going into the alcohol, or I'm going into those hard drugs, just as a way of escaping whatever is affecting me at that point.
Can it cause permanence?
Now, yes. In fact, studies that have been done have shown that alcohol use, bangi use, and all that actually lead to permanent medical disorders. I mean, not mental disorders. We have seen substance-induced schizophrenia, like Paul talked. Well, Paul was not talking about substance-induced, but that condition, schizophrenia, he talked about. There is a part of it that is brought about by alcohol. And then even some of these other drugs, again, that are used socially tend to lead to that. The other thing we know with these drugs is they cause dependence. Dependence in that the body cannot function without them. So if it cannot function without them, then the person wants to keep going back over and over and over to it until the point where when they stop, they get withdrawal symptoms, which in some cases can even lead to suicide. Yeah? So the drugs themselves, yes, lead to mental illness, and mental illness will also lead to the drug dependence.
Thank you so much for that contribution.